Definitely. So according to the American Diabetes Association, so the idea, they always publish like every year, every 2 years, something called the standards of care in diabetes. So those are like our Bible to follow when we see patients with diabetes. And one of them, the recommendations are at least 150 minutes of exercise per day. That I divided to my patients. Like if they do 30 minutes 5 times a week, they will get into that goal.
Okay.
And if they do more than that, it's even better. But at least if they can meet that goal, they're going to be good.
When you do recommend exercise to those patients, do you recommend like a certain type of exercise, whether it be like anaerobic exercise, aerobic exercise?
But it will be case by case, because it will depend on how you have this morbid obese patient that can hardly walk. Plus I start with something slower, so there's patients that they never stand up. So we just need to tell them, like, if you just train yourself to do at least 5 minutes of walking, and then you start going up every week, that will be an improvement. Or if I know that the patient can start at least walking, because the main problem with patients with diabetes is that the big or the great majority of them, they don't exercise at all. They not even go for a walk. So I usually start just by walking. Just go and walk 30 minutes, 5 times a week. And then after that, they can start increasing the intensity. And I always recommend it by watching your heart rate. If you know that your heart rate is going higher, so that means that you're exercising. So that's one of the guidelines. But if they're going to do exercise, and they can do exercise, always to do cardiovascular like exercise is better.
Do you ever recommend them to like a certain specialist, maybe like a personal trainer, to like help them with that exercise, or just like
it will, who has money to pay for a personal trainer? No, I always start. That's why I always encourage just by doing like small exercise. When the patients can afford it, which like really nobody can. But that would be the ideal, right? If they can have like a personal trainer, that would be the ideal. But to tell you the truth, I would say like 99% of the patients can afford it. So at least if I can guide them and see, okay, if you just do the walking and then try to do something more where you see your heart rate going up, that's the most we can do.
Yeah. Like there are a lot of patients that are, you know, more obese, or they might have other problems. You get a lot of patients that also have to go through like rehab in order to like at least be able to start exercising.
Very few patients I would send to rehab, because the idea would be to send more patients, but the thing is, so the insurance coverage.
Yeah.
Because really to justify rehabilitation for someone that is morbid obese is kind of hard. So some patients, like old patients, they will benefit from rehab because they can teach them how to, because the main problem with them is stability. So by certain type of exercise and rehab, they improve their balance and their gait. So, but yeah, no, I don't send so many people to rehab because of the problem with insurance that it would not be covered.
Okay. So after they complete or, you know, start participating in the exercise that you recommended to them, what type of changes like do you hope to see in those patients?
Okay, so number one, it will depend on how, like, for instance, in let's talk about like medication. So if they're in insulin and they start exercise, something that you see right away is that they recover the sensitivity to their own insulin for those that are type 2. So the requirements of insulin, they go down. So that's one thing. Then another thing, or patients are just taking pills, for instance, you will start seeing that they start having low blood sugar. So you start cutting down the medications. Yeah. But and in women, especially when they start exercising, you see like their mood is a lot better. They have a lot less depression. And that is being proved. There's a very good study showing that women that exercise at least 200 minutes per week, they have less anxiety and less depression. So those are other things that I want to see in my patients, like the motivation of doing things, the level of energy. That's something that you really see a change, because they're always complaining not feeling very tired and all that. But once they start exercise, they feel a lot of energy throughout the day. So the exercise is so good for your body as a whole. Like your mood, your mental health gets better. The amount of medications that you need to take, they also go down. Your level of energy gets a lot better. One thing that is not so obvious, or that you will not really see a big change, is in weight. Because people think that if you exercise, you're going to lose the weight. And it's already been shown that that's not how it works. With exercise, we can lose maybe 3-5% of our body weight. But when people lose weight, it's because they really changed the way that they're eating. And that's the only thing that is going to keep the weight down, and it's going to be like that for a long period of time. So exercise, like I always said, if you're doing exercise just for the goal of losing the weight, that's not the way to go, because you're going to get very discouraged if you're doing a lot of exercise and you're not seeing the weight coming out. But so that's something that I put very clear to my patients. We're doing this because of the whole benefit that you're going to get with it. Okay. But not for weight loss.
Yeah. So, and like you said, you would recommend more, like for a patient to focus more on their diet over.
100%. Yeah.
Okay. So you also focus, or you specialize in endocrinology. So like, what type of different like hormonal responses would you like expect to see when a patient starts performing exercise?
So one thing is insulin levels, they go down. Yeah. So it's one thing. You will see like their levels of sugar, they get in a better range. But there are other hormones that we still don't have like a lab to check them, like serotonin levels, norepinephrine levels, serotonin levels. We know that they also go up, and those usually are measured when they're doing a study. But hormone-wise, one that is very easy to check and you can really see the difference in your insulin levels. So these patients tend to have hyperinsulinemia, so the levels of insulin are very high. Once you do exercise, they go down.